Okay, so we are discussing the bones of the wrist and hand. So basically we have the, if you see, look at the anterior palmar view. So we have two rows of the carpal bones, among which the total of 8 carpal bones and 5 metacarpals, and we can see the radial hand, distal hand, and the ulnar distal hand, with the ulnar styloid on the medial side and the radial styloid on the lateralmost side. So basically if you look at the wrist joint, so the wrist joint is formed mainly by the tubercle. This is scaphoid bone, so this is scaphoid bone, okay, and here we have the lunate bone. So the first row is like this, so she looks too pretty. So we have scaphoid, lunate, here we have the triquetral and the pisiform. So and this is the hook of pisiform, tubercle pisiform, and here we have the next row starting from type trapezium. We have the trapezium, so this is trapezium, this is trapezoid, and this is capitate, and then we have the hamate, and this is the famous hook of hamate. So here we have the radius, the radial styloid process, and this is scaphoid, and this is the tubercle of the scaphoid, and this is the vest of scaphoid. So most commonly it fractures here. So if you look at the wrist joint, so the wrist joint is composed of the you can see the radius and the scaphoid and the lunate bone, and here it's a synovial hinge type joint, and here we have the distal radio ulnar joint, this one. Okay, so this is the posterior view or dorsal view. So posterior we have this the famous Lister tubercle of radius, and then we have the ulnar styloid process, the ulna and the radius, and then we have the radial styloid process, and this is trapezium. So we have the okay, so since this is a dorsal view, so you will have this is the thumb, so you have the scaphoid here and scaphoid here, and then we have the scaphoid, lunate, and triquetrum, and pisiform will be absent from this view. So this is very important. Why? Because in ulnar, in radiographs, you have to use this trick. I will show you now. And then we have the other bones are, you can see the trapezoid, sorry, the trapezium first, and then the trapezoid here. This is the trapezium, trapezoid, and the capitate and the hamate bone. So this is important because you will identify X-rays through this. So if you look at this radiograph, especially this one, so here you can see that we have the numbers and their identification. So here you can also tell this that this is the dorsal view, and if you if it's the dorsal view, then it's the right hand, so you can determine the side as well. So this is the right hand taken from the dorsal view. So here your thumb, and this is the small finger metatarsal. So here we have the ulna, the ulnar styloid, the radial styloid, and here most probably we will have the the Lister tubercle, but it's not visible here. So here we have the scaphoid, number one is scaphoid, and we have the lunate on number 2 B, and then we have the triquetrum on the 3. So scaphoid, lunate, triquetrum, and pisiform. So pisiform is absent from this view. And then we have the trapezium and the trapezoid, and then the capitate and the hamate, and here the hamate tubercle. So this is how you determine. So if they ask you what are the moments of the hand at the wrist joint, so this is abduction, radial tilt, and if you go medially, so this is adduction. So we have extension and flexion. So these are the moments of the wrist joint. So here again you can see this is a plane radiograph from the side view. So in side view, you remember that inside view you always see the lunate bone. So if someone asks you the carpal, among carpals you see the lunate bone, and this is the articular surface of the radius and the radius, and this is the ulnar styloid, and here posteriorly we see the triquetrum bone of the first row, and then you will see opposite to it the capitate bone, here. Okay, so this is the capitate. So this first metacarpal, and you will see the hook of hamate. Okay, and here this bone right below the first metacarpal is the trapezium. As you can see here, this is the trapezium just below the first metacarpal, so this will be trapezium. So this is the identification tricks. And here we have the scaphoid, below it will be the scaphoid. Here this one, this is the trapezium, this will be the scaphoid. Here you can see this trapezium, this scaphoid. So, and pisiform bone. So if this is lunate, above the lunate we have the always the pisiform bone, so this will be the pisiform bone. Okay, so here we further we can see here it these diagrams, we will go through these diagrams. So here we can see again that it's the 16 is the, sorry, the 23rd is the, you can see the 23rd is the ulnar styloid. So you can confirm here styloid process of ulna, 23. Then we have the 11, the head, the distal end of the ulna on number 11, or head of ulna. And then we have the radial styli on 22, styloid process of the radial. And then we have this row, you can go the head of the first metacarpal, or the base of the first metacarpal, and this is the sesamoid bone of the first metacarpal. So 20 is the sesamoid bone in flexor pollicis brevis, and then we have the 1 base of the first metacarpal. Yes, 8 is the head of the first metacarpal, base of the first metacarpal, head of the first metacarpal. So 24 is your trapezium, and then we have the on 25th. So this is, if this is trapezium, this will be trapezoid. 25th is trapezoid, and then we have further the capitate on number 4, and the hamate number 7, and this is the tubercle of hook of hamate. 12 is the hook of hamate, and 7 is the hamate bone. 3 is the base of the third metacarpal. Okay, so here we have the 19 is scaphoid, and 13 is the lunate, and then you have on 26 is the triquetral, and 15 is pisiform. So you can confirm here 15 is pisiform, and on 26 is the triquetral, and then 13 is your lunate, and 19 is your scaphoid. You can see here. Okay, so this is all about. Okay, so what is 24 So 24 is the trapezium. So this is trapezium, this is trapezoid. So this is yes, and then we have some here. So this is the first proximal distal phalange, and this is the proximal phalange of the first finger. So on number 6 you can get distal phalanx of the thumb, and uh, the on number 6 distal, and number 18 is the here you can see the proximal phalanx of the thumb. Proximal phalanx, distal phalanx. Okay, so here you can see the head. This is the head of the second proximal phalanx. This is the body, and this is the base of the second proximal phalanx. So you can see number 2 is the base of the phalanx, and 21 you can see the shaft of the phalanx, and then on number 2, on number 9 you can see the head of the second phalanx, proximal phalanx. Same goes for this, and this is the 10 is the head of the third metacarpal, and 3 is the base of the third metacarpal. So this is all about this radiograph. Okay, so here these the children, 4-year children, child radiograph, and here you can see again the 23rd is the radial ulnar styloid. Sorry, this is the radial styloid. 11 is the head of the ulna. Then we have the again the same nomenclature, and here again this is the lateral view, so it's a bit confusing. So you should know that this is always the lunate. This is always the lunate, and here this is always the lunate. Here we have the scaphoid. 24 is trapezium, and this is the first metacarpal, and here we have the capitate always, and capitate, and the 11 is the ulnar head or ulnar styloid. You can see 13 is the radial styloid. Okay, so these are the um, different views of the just you should know the the nomenclature. Okay, so again here we have the, and this is the radius, this is the ulnar head side. Here we have the radial head, sorry, ulnar head. Here we have the radial head, and here we have the so here we have the scaphoid, the yes, so scaphoid. So this is tubercle scaphoid on number 12. Sorry, this 11 is scaphoid. Okay, 11 is scaphoid, 12 is trapezium, and then we have the trapezoid on 13, and then we have the triquetrum. This is this scaphoid, this is lunate, this triquetral, and here on this the arrow we will have pisiform. So 14 is triquetral, and 9 is always and always the lunate. So here we have the on number 6, this is the distal groove. So here we have the trapezium, trapezoid, capitate, and hamate, and these are the bases of the third, fourth, and second. Okay, so base of the fourth metacarpal, second metacarpal, and so on. These are the bases of the metacarpal. Number 10 is okay, races of distal radioulnar. Okay, so this is the distal radioulnar joint, and here we have the wrist joint proper. So this is the radiographic view of this. So this is also important. The 12 is trapezium, trapezoid, capitate, and hamate. Then we have the scaphoid, lunate, and here we have the triquetral, and the pisiform is not in the view. So these are the contrast accumulation in the metacarpal joints, and 7 is the ulnar head, and here we have the distal radioulnar joint cavity and contrast accumulation, and so is the radial head. So this is all about the wrist joints and their x-rays. Okay, so we can, so these are the important things. So, and this dorsal lister tubercle is important, and so this is also important. Fracture of scaphoid. So retrograde, we can make another video about it as well.